Welcome to the Wellness Show. I'm Dr. Keisha, your host, and so glad that you've tuned in for today's episode. As we continue to encourage you in your 2018 journey into health and wellness, we have carved out a special episode for you today, and the topic is pelvic health. We've invited a special guest who's an expert on this topic. She's a physical therapist and has been practicing for over 20 years. She is co-owner of Carolina Pelvic Health here in Raleigh, North Carolina, and she's such a great resource to know. And I might add that she has been a speaker on pelvic health both locally and nationally. So without further ado, I introduce to you and welcome Emily Wegmann. Emily, so glad that you've joined us today. Thank you.
Thanks for having me.
Yes, you've carved out some time out of your busy schedule, helping all of the people in the community, which we appreciate greatly. And we're thankful that you're going to share with us all about pelvic health, because it's very important and a lot of information to share.
Yeah, I'm excited to answer your questions and share the knowledge.
Thank you so much. So we'd like to get a chance to get to know you first. So share with us your motivation as well as your passion in becoming a physical therapist and specializing in pelvic health.
Yeah, so my exposure to pelvic health started when I was a student learning about physical therapy. So even before physical therapy school, out in Seattle where I'm from, I was able to work with one of the world's best experts in pelvic health, Kathy Wallace, in her clinic, and she introduced me to pelvic health, and I just became really impassioned about empowering women and taking on a new avenue of therapy. And so after school ended and I graduated, I began at a new company that had another person who's great in pelvic health, Holly Tanner, and she took me under her wing and started a women's health program for that company, and that's where it all began, with courses and exposure, and then in the last 10 years really just going forward with primary pelvic health, and with the goal of empowering women and men to seek treatment for things they don't often know is even available to get help for.
Absolutely.
So yeah, that's our community mission and global mission. So.
Great, and how inspiring. And it sounds like you were taught by a lot of the top experts in the country, and so you have a lot of tools and knowledge underneath your belt, so that's wonderful and great to bring from Seattle all the way to North Carolina.
Yeah, coast to coast.
Absolutely. So that is truly a gem that we have here in the community in the Raleigh area. So share with us about all the services that you provide at Carolina Pelvic Health here in Raleigh.
Yeah, so the pelvic floor is very specialized, but it's also kind of the dynamic stabilizer of the whole pelvis, which helps us move and support our spine and our hips. So really it helps treating the whole body. So we do specialize in the pelvic floor for treating things like bowel problems, bladder problems, chronic pain, postpartum issues, menopausal issues, SI, back pain. But we really take approach to the whole person, looking from the foot all the way up to the head, and how those things can affect their system, as well as how the nervous system plays a role. So we're doing a full assessment of their whole body and how that fits in with their problem.
Oh, that's great. So, and that's wonderful, because, you know, as we learned when we were young, everything is all connected, right?
Exactly, exactly.
So hence, that's why you look at the person as a whole and you treat any dysfunction and all that may be related to that dysfunction. That's really important. And such a part of wellness. You know, wellness is the total body. So that's wonderful to hear that you have that service. So today we're talking about pelvic health, and we want to hear about the different structures and components of the pelvic floor. So a little bit of anatomy 101.
Yeah, so I have a little handy model with me. So and this is a female model of the pelvic floor. So we'll kind of learn a little bit about the muscles, but to know first that they're skeletal muscles, just like our arm or leg muscles. That's really important. People don't always know that they have muscles that they can voluntarily contract and relax or expand based on what they need to do. And they do have a little autonomic nervous system innervation, which is great, so we don't have to worry about losing control of our urine or passing gas when we don't want to. So there's always a little bit of control going on there. But the muscles are skeletal muscles, and they go from your pubic bone, which is at the front of the pelvis here. The two pelvic bones come together to make your pubic symphysis, and then they meet in the back with your sacrum to make your sacroiliac joint. And right at the bottom of that is your tailbone, and we all kind of know about that tailbone. Maybe we've fallen on it once, and it might have a little soreness, but the tail is very important for supporting the pelvic floor muscles as a site of attachment. And the muscles are like a hammock or a sling going from the tailbone to the pubic bone, and then side to side from the sit bone to sit bone, those bones that we sit on.
Yes.
So they're layered. We have our urogenital triangle muscles, and then the deeper muscles of the rectum and the pelvis, which are called your levator ani muscles. So, and this is that hammock or sling going from pubic bone to tailbone and back out. And they're also very unique because they attach onto a hip muscle called the obturator internus. And so they really play a role in hip dynamic function, as well as supporting the bony pelvis and the organs. So the pelvic floor has a big role in supporting the pelvis, but also the organs. It's the bladder, in women the uterus and the rectum, and in men the bladder and the rectum, so that the organs stay in place. They're a dynamic stabilizer with our abdominal wall and our diaphragm and our back muscles to stabilize the pelvis and the spine. And then they also work with our hip muscles so we can walk and run and jump and not lose any control of our bladder or our bowel. So they really play a primary role in both mobility, but also just daily activities.
Absolutely.
So, and bodily functions.
Yeah, so hence we want everything working properly so that, number one, we have pelvic health, but also health throughout our entire body as well, and able to function well, able to do all the various activities that we are able to do.
Yeah.
So share with us some of the common pelvic disorders that you may treat with both women and men.
Yeah, so the role of the pelvic floor is really to be supportive of our bladder function, our bowel function, and our sexual health. So oftentimes we'll see folks that have leaking of urine with maybe cough or sneeze or running or other jumping activities. Or maybe they have to go to the bathroom all the time, and they're the folks that know where all the bathrooms in the mall and the neighborhood are, so that they're not going to have a leakage event when they're out and about. And some folks may have difficulty emptying the bladder, or may say that they have a shy bladder, and that's usually related to muscle tension and not being able to relax. And then we have folks that have bowel problems, like chronic constipation. The pelvic floor actually has to relax in order for us to have a bowel movement. And if we're holding it tight all the time, we can lead to chronic constipation and then sometimes even fecal incontinence. So we deal with those types of issues, all the embarrassing issues.
Sure.
And then sexual health is a big one. So some folks may have problems where they can't have intercourse at all because the muscles are so tight. We call that vaginismus. And they basically have a protective tightening response. And so we'll help those women really overcome that fear of penetration, whether it be for tampon use or GYN exam or intimacy. And sometimes we have folks that have problems after having baby. Maybe they've had a scar from tearing or episiotomies, and those muscles needs to heal, and so we'll help with scar mobilization and really helping them have that intimacy again and comfortable muscle mobility. And then as well, some folks just want to have a more exciting sexual experience, and so the muscles help with pleasure, so we'll help with that. And then men may have problems after prostate surgery, or they too can have problems with pelvic floor tension, which leads to difficulty with bowel and bladder control and sexual activity. So those are the primary pelvic issues, but we also see secondary, because of that attachment to the hip, that we have problems with hip labral tears, hip pain on the outside, chronic SI pain, coccygeal or tailbone pain, and then persistent low back pain, because your core is, your pelvic floor is really a part of that core system, and so if you're not using it correctly, then it's difficult to do all those strengthening exercises to support the hip and the back. So.
That makes sense.
Yeah.
That does make sense. Thank you for bringing it all together for us.
Yeah, so kind of do it all, inside and out.
Absolutely,
Yeah.
absolutely. It's interesting to hear about, you know, all the structures and the responsibilities of the structures and how that affects our bodies and our entire life. And yeah, so very interesting, very, very interesting. So share with us some of the common causes, signs and symptoms of pelvic disorders, both in women and men?
Yeah, so some of the causes can be due to childbirth in women, so having a baby either vaginally or cesarean can lend to pelvic floor dysfunction, either that because they become really tight or that they've become weakened or both, and so we'll deal with that. Or sometimes folks have had an injury in the past, maybe a slip or a fall, that's led to compensations and the pelvic floor muscles start to tighten and they become painful. Or maybe there's no cause at all, we call that idiopathic, it's just come on. And it's due to prolonged tension or poor postures, a lot of sitting. We all are computing and driving and using our laptops inappropriately.
And cell phones.
Yes, and we build up a lot of tension in the pelvic floor, just like folks can be jaw clenchers, they can be pelvic floor tensors, and that can lead to all sorts of pain disorders, painful sitting, or stress incontinence. And also after surgeries, so prostate surgery, or bladder sling surgeries, or any abdominal surgery. So
interesting. Thank you for sharing that.
Yeah, and some of the symptoms that folks might have, one is if you're having pain, you may have pain in the abdomen or in the lower quadrant, pain in the rectum, pain in that kind of hard to reach place in your hip that you wish you could kind of put a finger on but you can't, in the groin or on the outside of the hip. And then you may have symptoms of bladder leakage when you cough or sneeze, run or jump, difficulty emptying the bladder, pain with any sort of penetration, difficulty having an erection if you're a man, or sustaining it, painful bowel movements, and things like that. So, and if you're having any bleeding with any of those bodily functions, you definitely want to go to your physician first to rule out any of the big and scaries, and then we can come to physical therapy.
Absolutely, and that goes along with my next question to you, because it can be a personal subject. Pelvic health can be a personal subject, yet there are a lot of people who experience pelvic dysfunctions, disorders, and conditions, and it's commonly treated by physical therapists. Share with us when you recommend, or at what point do you recommend for someone to seek your professional assistance?
Yeah, so first on the wellness aspect, if you're going back to exercise or you're exercising and you're not quite sure if you're using those core muscles correctly, or if you feel maybe you have a diastasis after delivering babies, coming to physical therapy is really important so you know how to use those muscles correctly, the timing, the sequencing, the coordination, and then we develop a nice individualized program for you to learn the basics so then you can go into those fitness and community classes with confidence and prevent future problems. And certainly you want to try to come in and learn how to use those pelvic floor muscles if you're having any sort of leakage or problems with intimacy. So it's a good way to come in for wellness, and then after baby, for certain, that's a great time to come in, because in other cultures and countries, you deliver the baby and then you go to pelvic floor rehab and learn how to use those muscles which have been stretched for almost 10 months and may have been torn. And in our culture, it's not part of that healthcare system. And so we like to, all of our pregnant patients, we like them to come back after they've had that 6-week OB visit and get a pelvic wellness assessment and then tackle any problems so we don't have any future issues down the line. So,
so hence pelvic health is so important.
Yes,
Yes, in all aspects. Very good. And share with us some of the common treatments that you employ with people who have pelvic dysfunction.
Yeah, so even though pelvic floor therapy seems a little bit different than regular physical therapy, we're still doing regular physical therapy. So after we do our muscular assessment, we may teach you how to coordinate your muscles. So we do some retraining of your neuromuscular system. We often use the breathing to help with timing and coordinating with your pelvic floor and your abdominal wall. So most folks are going to learn how to breathe on day one, and everyone's like, why am I learning how to breathe, and why is this so hard? But the diaphragm and the pelvic floor connection is really critical for managing that intra-abdominal pressure. So we use a lot of neuromuscular retraining, and then we use hands-on techniques called manual therapy if we need to do any soft tissue mobilization or move the joints that might be stiff. And then our primary goal is to get folks exercising and moving, just like all regular physical therapy. So we start a home exercise program on day 1, and then we continue to progress that over the coming visits. And we analyze your movement, and in fact, I've had patients where, you know, I'm leaking when I'm bending over, when I'm maybe feeding the dog, and just like any other physical therapy visit, well, let's see you do that.
Right.
We analyze the movement. Well, you're bending at the waist instead of squatting. We teach you how to squat properly, and you're no longer leaking. It's an easy fix. So those are the easy ones.
Yes, I was going to say, yes, those are the easy ones.
Yeah.
And it's great because it restores function, and you're able to actually look at a person's general movements and movements where they're also having the issues and correct those and give recommendations and suggestions, and so they can continue and be restored and continue those various activities.
Exactly.
Excellent.
Yeah.
Excellent. Well, thank you for sharing. Like I said, is that you provide a great service here at Carolina Pelvic Health, and I know that you're a co-owner with your business partner, and so there's two.
Yes, there's two of us.
There's two here. So I know that you provide such great service, and the treatments that you've shared, that's great, you know, from manual therapy and lots of education, postural re-education, and you utilize various biofeedback tools and neuromuscular re-education tools to help the person rehabilitate and get back to normal functioning and feeling well.
Yeah, exactly.
So that's really important.
Yeah.
So I know we talked about moms having babies before. There's a lot of buzz going on in the community among the postpartum women. Sharing, have you seen your physical therapist for a pelvic exam? Share with us why it may be important and beneficial for a mom to have an appointment with you to get a pelvic checkup after they've given birth.
Sure. Like I mentioned earlier, pregnancy is a big load on the pelvic floor. So you have 10 months of a nice steady load on those muscles, and they're accommodating that big stretch. And then with labor and delivery, the baby's passing through those muscles and they're stretching enormously, and then they have to recoil.
Okay.
And so after that, just like any other muscle group, we need to learn how to retrain them. So they've sustained a big force through the delivery, even if it's C-section. And so what we like to do is make sure that those muscles are contracting properly, relaxing properly, and expanding, so that we can have support of the organs. We don't have any organ prolapse, so that we have bowel control and bladder control, and that they can return to exercise safely and properly, and intimacy, so that they can enjoy being with their partner. And some of the common things that occur with moms is, what do I do with that scar that's occurred with tearing or episiotomy? It's tender, I don't know if I should touch it, or should it stretch, should it be painful? And so kind of tackling those myths and getting that scar tissue moving right away is important after that 6 weeks, so that those muscles can contract and relax appropriately and be very strengthening to the pelvis. The other thing we check is for diastasis, because it's not always consistent that they get that at their postpartum visit with the OB. And then teaching them how to use that integrated core system so that they can go back to exercise when they're ready to. And unfortunately, there's not like a set guideline for return to exercise postpartum. So it's very individualized per patient, and until we get some very standardized guidelines from the medical community, we take one patient at a time. And so we help work with women to establish their fitness goals. If they're having any dysfunction with bowel or bladder or intimacy, we work on those goals, so that we can get them back to being happy, healthy moms, and very strong, so they can carry the load of the baby and themselves and get back to being very fit.
Absolutely. And I can imagine that information is very valuable, particularly because sometimes if it's not treated or looked at immediately, then later on down the road, years on down the road, there could be some dysfunctions can develop as well.
Yes, and oftentimes there's common myths like, well, I've had a baby, so I'm going to leak. So even though that's a very common, it's not normal to leak. So if we can kind of change the the myth in the community to say, hey, yes, this happens with pregnancy, but I don't need to live with it,
Right.
then we can address that problem before it gets worse as you get older and older.
Absolutely.
Yeah. So
And that's a good preventative measure that you can take so that as you get older, like you said, is that you won't have those leakages.
Exactly.
Mhm.
Yeah, and you can be as mobile and active and as possible. So
Absolutely,
Yeah.
absolutely. Very interesting.
Yeah.
Share with us how one can prepare for an initial visit with you, as well as what to expect.
Yeah. So the first visit is like any other physical therapy visit. You want to be in comfortable clothing. There's not much to prepare for as far as just basic paperwork. But because we're dealing with organs as well, we really want to make sure that if there's anything like bleeding or night pain or signs of infection, that you go to the doctor first.
Sure.
And then when the doctor's cleared you, then we come to physical therapy. The advantage in North Carolina and many states is that there is direct access.
Mhm.
So folks can come right to our office without seeing the physician, and that's okay. And because of our education and training, we can identify when there is something that needs to be referred back to the doctor,
Sure.
such as infection or cancer or maybe fracture. And even though we don't do those tests, we have a great community of physicians here where we can say, okay, go see the physician. We really think you need to get this ruled out. And then you may be appropriate for physical therapy.
Absolutely.
And so that's really important. So that would be kind of how to prepare.
Yes.
And then as far as what to expect, again, it's another physical therapy appointment.
Yes.
So we're going to have a review of your medical history, learn all about what your goals are, what you want to achieve, what you've already done, what your symptoms are, how is this preventing you to live the high quality of life that you want.
Yes.
We look and examine those muscles, so it's a little bit different than being out in the open gym. We have private treatment rooms,
Mhm.
and you're properly draped, and we do a pelvic floor muscle assessment, either intravaginally or intrarectally, depending on what we need to do. And we'll teach you right away how to use those muscles, whether it be to relax them or strengthen them.
Yes.
And you'll go home with some wonderful exercises right at the beginning. And lots of education.
Yes.
Physical therapists love to educate.
Yes, we do.
So we educate a lot about the anatomy, the function,
Mhm.
and the nervous system to get them feeling better. So,
Great.
Yes.
And on average, everyone's different, but in general, how long does the first visit take typically?
So we see patients for 1 hour each visit.
Okay.
So it's one-on-one with your physical therapist. There's no aides or technicians, and each appointment is 1 hour.
Okay.
And generally we see people once a week for at least a few weeks, 4 or 5 weeks, and then we spread it out, because a lot of this is after you get the neuromuscular retraining, it's strength training, and we know that takes about 12 weeks to occur. So we start out a little bit more frequently and then spread it out over time.
Interesting.
Yeah, and our goal is to empower the patients so they can take care of themselves.
Absolutely.
And not need us all the time.
Yes,
Yeah.
yes, enhance that quality of life that
Exactly.
we yearn for.
Yes, exactly.
Well, wonderful. Emily, you have been wonderful in providing a wealth of knowledge.
Thank you.
I greatly appreciate your expertise, your knowledge, your education and background in pelvic health. I think it's one of the areas that we don't hear about as often as other areas, musculoskeletal, areas such as the shoulder and the knees, the spine.
Yeah.
So I greatly appreciate you taking the time, sharing with us your models
Yes.
and all of the different components of the pelvic floor and the different dysfunctions that both women and men experience.
Yes.
So I really appreciate your time.
Thank you.
Yes, thank you for joining us, and
Yes.
I wish you the best in your facility and with Carolina Pelvic Health and all that you do for the community.
Thank you so much for having me.
Thank you, my pleasure. And so if you are in need of Emily's services here at Carolina Pelvic Health, please go to carolinapelvichealth.com, or you can certainly pick up the phone and call them. And there's a caller right now for Carolina Pelvic Health. They are wonderful. They have a great team and staff here that are very caring and helpful to help you get through your experiences and overcome what you may be experiencing, and of course, restore you to a good quality of life. So as always, we appreciate you joining us on the Wellness Show. As always, we wish you well today, tomorrow, and years to come. So if you need additional information on pelvic health, again, go to Carolina Pelvic Health. And again, we wish you well.